I would say most of the time, one of the things that you really can't joke about would be a euthanasia during that scenario. Every once in a while, you run into a situation where you can interject a little humor to give a little levity. But most of the time, the people are grieving, they need a chance to grieve. And usually humor is probably not a good thing to try and interject there. Again, if you know the client real well and some other things, that can be a different story. But, in broad sense, that would be one. Certainly any time that you have to give a follow-up. So, like for example, if client's waiting for biopsy results from some sort of lump, even though we're pretty sure it's benign, that's still always an anxious thing. Of course, as doctors, we kind of are more comfortable with that than our clients, so, while we may realize, there's probably nothing to worry about here, the clients are still worried about it. And so when you get that report and you can call them up, that's probably not a time to joke because they're still kind of anxious. You and I, because we are so familiar with it, that familiarity doesn't concern us with that. But the clients, and this is where understanding the audience, where this is their pet, they don't have a lot of lumps that they've removed, and so this can be kind of a scary thing. So that can be something that's not very good to joke about as well. And I would say probably the third one where I very rarely will interject any humor is usually a post-op call. So usually, most of us will call our clients after surgery of a pet to let them know how everything went and that they're recovering fine and that type of thing. And that's, again, a time where, in surgery is kind of an anxious time. They want to know right away that everything went well. And so that's also a time that, at least at the initial part of the call, you certainly don't want to use any humor or interject anything that may be taken wrongly with that. Now, once you've said, hey, we just got done with Fluffy surgery, everything went fine, we trimmed their nails for you, and as you've already let the tension down that they may be nervous, then you might be able to interject something if you were doing some other procedures or you had some other questions or things like them to do. So, but I would say those would probably be the three most common areas in practice that probably humor you're better left, okay, don't worry about trying to interject any humor here.